Hello, good evening. Today, we are going to discuss the case note of Mrs. Emily Ryan, a 59-year-old female patient who had the diagnosis of viral infected splenomegaly, and high blood pressure. So you are going to write this letter to Anna D'Souza. She is a senior nurse at old age nursing home. And she is responsible right now for the continued care at the nursing home for Mrs. Emily Wren. So you are writing to a responsible person who is going to take care of Mrs. Emily Wren, your client. So this is what we have understood. Continued care. You're transferring you have been giving care, and you're giving off the charge of the care to a different setup. But the treatment or the care should continue there also. So this is what this thing is. It's not a complex letter actually. So first of all, we need to see what all things we need to include here. So when it comes to patient details, we need to include the marital status if we need, the admission date. Yeah, sometimes it's optional. So it's New Life Hospital that you're working in New Life Hospital. You can write under, and the discharge date. So you have to write on the top. Diagnosis you have to include. Social background is somewhere important there, but you don't need to write the address there. And about the medical background, it's also relevant there. So it's about the food poisoning and high blood pressure, medications, nursing management. Now, all that we do have a very brief case note, so I have to be very careful in organizing this thing. So without any information given in the case note, you cannot assume and write anything. So if it is and now this condition is splenomegaly, and they are telling post-operatively, so we have no information when the surgery was done. Who did the surgery, when the surgery was done, what was the condition prior to the surgery? Nothing is given, so please don't assume. And if there is a connection problem, so please don't fill with your assumptions. So we can only write what is there in the case note. Okay, so this is what we have to see. This is a brief case note, and we need to see. Let's see the presentation here. So today's date is 15 June 2013. So it is correct, 15 June 2013. Yes, Anna D'Souza, senior nurse, old age nursing home, 155 Commercial Street. Yes, London. Dear Miss D'Souza, yeah. Miss Emily Ryan, 59 years old, clear. Now let's see the letter as a whole here. Yeah, that's it. This letter is being written to discharge Miss Emily Ryan, Mrs. Emily Ryan. So I have to correct here. It's Mrs. Emily Ryan, who requires your continued care and nursing service from today. So it requires your continued care and nursing service because she's a senior nurse. Care and nursing service is needed. So we have wound dressing there. We have to monitor her BP, all these things. So we have to care her, the general care, and including general care and nursing care. So that's why we have written continued care and nursing service from today. So from today itself, when we have written today, that's the date is there, 15 June 2013. This is the date you have to start this care. She has been under our care for the treatment of splenomegaly, which resulted from a viral infection. So yeah, primarily she was there under your treatment for the 2 months for splenomegaly, which resulted. So how the splenomegaly occurred is because of a viral infection there. Now let's go ahead and see the next paragraph. That's the social background and the past medical background. So regarding the social background, Mrs. Ryan is a widow, lives at ASP house and has a married daughter who works as a lecturer. This is written because the daughter is working. She's married and she has other responsibilities, and she won't be able to accommodate her mother with her right now. So there is a difficulty, and that's why she's transferring Mrs. Ryan to the old age home there. So Ms. Ryan, widow, lives in a SP house and has married daughter who works as a lecturer. In terms of her past medical history, okay, there was something given as a brother who was very supportive, his elder brother, Mrs. Ryan's elder brother, who is about 67, I think so. So he is a very supportive man, visits her. Okay, but he's also old, that this person is elder, and he's nearing to he's 70. So he won't be able to take care of this. If you want, you can include that too. So it's an optional sentence. Elder brother is very supportive, but he is also age. You can say that this is a difficulty to include every data. So primarily the next of the kin is the daughter. That's why we have mentioned there. So she is responsible because brother can only visit. He's not going to stay with her, with his sister right now. So in terms of the past medical history, so regarding the past medical history or pertaining to the past medical history, Mrs. Ryan has had hypertension since 2006. Spent a month in our hospital in 2009 for the treatment of food poisoning. So we have focused on the second diagnosis, that's the hypertension. So we have said two diagnoses were there in the case now. First is the splenomegaly, and the second thing is the hypertension, high blood pressure. So hypertension. So if you are mentioning hypertension in the purpose paragraph, please don't mention here. So I took it here just because it's a past medical history. It started from 2006. So, and one more thing, that she has a previous history of staying here, admission here. It was on 2009 for food poison. It was a 1 month stay. That's something relevant. That's why we have mentioned it here. Now, let's go ahead with the next paragraph here, post-operative. So in between, we don't have anything there in the case note. So we are helpless to add something there. So we have to say post-operatively, Ms. Ryan was administered pneumococcal, meningococcal, and Haemophilus influenzae type B vaccines. So these were the vaccines which was administered post-operatively. And she was also recommenced on aspirin. So post-operatively, she was on aspirin 100 mg somewhere before, and now post-operatively it was restarted. This is what we have said. And the daily wound dressing at the surgical site was provided. So we provided, and this has to be continued at your care. At present, her general health condition is good and BP is within the range. So you are writing to a medical professional, so I can write BP. She's a nurse, she can understand what is BP. Other than that, please don't write BP. So you have to write blood pressure. So as far as you are writing to a medical professional, so you can go with BP. It's universal. If you go with BP, so everyone can understand it is blood pressure. So it's a universal abbreviation. So universal abbreviation can be used, and if only the condition is that, then if you're writing to a medical professional. Okay, so we have said BP before, that high about the BP, that is high hypertension, on the aforementioned paragraph 2. So we have completed the next thing, that's about the condition. So what care we have given? She was given with some vaccines, and she was restarted with aspirin, and she was given wound dressing, and right now her condition is good. BP is within the range, her condition is clear. Now, what is the requirement from your side? It would be appreciated if you could take over the care of Mrs. Ray. Okay, so it's here also, we need to correct it as Mrs. Ryan. But also need to correct Mrs. Ryan, because it is in the case note, it's Mrs. Ryan, so I have to say Mrs. Ryan. Mrs. Ryan, especially medication complaints, including injection penicillin. So she has certain medicines. I don't know what all the medications, because what we're given, we have mentioned she might have medicines for hypertension. It's not given here. So because if even though hypertension is within the, so blood pressure is normal, it can go up anytime. So you need to monitor, and you need to keep medications appropriately, as well as you are a senior nurse there. So the thing is that she might have BP medications too. So I have no information in the case note. So I just have to say medication complaints. Sometimes she may have to repeat the vaccines, what pneumococcal or meningococcal or some vaccine she need to repeat. So I don't have the list with me. So I have written medication complaints, and especially I have to say something about penicillin. So that's what they gave in the brackets, the penicillin. Okay, so that we have to highlight. We have highlighted it. Now, she is not recommended to do vigorous exercise and travel. So she is not recommended to do this vigorous exercise. She's 59, but she is, if she is, even though she is willing to do so, you cannot allow her to do so. And please don't encourage her to travel. And please remind that she has her follow-up FB test at our care or at our hospital. It's not our care, it's our hospital. At the hospital. Okay. Hospital. Okay. Now, if you have any further queries regarding Ms. Ryan, okay, please do not hesitate to contact me. You're sincerely registered nurse. Now it's New Life Hospital, I think so. Let's see. Yeah, it's New Life Hospital. So you can add New Life Hospital there, registered nurse, New Life Hospital. Some will be writing their names in full caps. So here I have not mentioned any name there. So it's the hospital name. So you can write as it was given in the case note. We have copied it. That's it. Thank you. And that is the end of the explanation here. Thank you.